I think it's pretty clear, and this was always the case, it was going to be pretty clear, that the PCR tests that are done in the central laboratory are better in almost all respects than the rapid tests, except for the turnaround time. They are slower. If you have a swab and there's about 100 or 200 viruses, just 100 or 200 viruses on that swab, we can detect that with a PCR. For a rapid test, an antigen test, there usually needs to be tens of thousands or maybe hundreds of thousands. And so there's just a lot more virus that needs to be there. If someone is symptomatic, it makes the most sense to take the test that is actually available at that time. And the clinical performance of an antigen rapid test is good enough such that you will get a pretty good result, a pretty reliable result in that context, whatever type of testing that you use. In asymptomatic patients, what you really want to focus on is the most sensitive approach you can. You really want to be sure that that person doesn't even have 100 viruses in their nose. And the way that you can detect that is with PCR. And antigen testing, as we know, sometimes can catch those patients, but oftentimes it misses them. And so it's not the best strategy for that situation. I think it is a great thing for someone to have, either to buy at the drugstore or to have a stash of these things at home if they have them, to assess if they get the sniffles or a fever or a cough or short of breath, to get a really quick idea of what this could be. A use that's not so good, however, is completely asymptomatic individuals testing themselves to see if it's safe to go have a family reunion or something, or go to the theater or go to an event, go into close quarters. They really do not have the diagnostic power to suggest that.